everybody. Welcome to this webinar. Right, I'm Olusegun Adetunji. I'm a GP and I live here in Chelmsford. Today we'll be looking at back pain, precisely low back pain. And this particular topic is very important, number one, for health reasons, as well as for economic reasons. And we'll see what this means as we go ahead. Now, shall we move to the next slide, please? Right, back pain. We mentioned different names in there, which we could call it lumbago, we could call it sciatica, we could call it radicular back pain, and we could call it musculoskeletal back pain. But what does actually this means? Pain and discomfort, which is localized below your coastal margin, just below your ribs cage at the back, to the area of your pelvic bone, just around the lower back there. Any pain around that area will be tagged, a back pain. It could go to the legs or it may not. If it goes to the leg, we call it a different name, which we call radicular pain, which could be because of inflammations or compressions of the nerves, and it radiates to your legs or to your calf muscle, which is back of your legs. And this pain could be reproducible by sitting or walking. And sometimes you could have tingling and numbness and muscle weakness and loss of specific functions, as it may be, depending on which stage we are. I must say here that generally back pain is very, very common. And 80% of adult population suffers back pain in their lifetime, while 10% have back pain at any given time. As we're talking now, at least 10% of the population will have back pain. I wouldn't even be surprised if none of us sitting at this seminar does not have a back pain at the moment that we're talking. So lumbar radiculopathy as an entity is the most evaluated back complaint in men and women by spinal surgeons worldwide, and accounts for about 3 to 5% of the populations. Next slide, please. Now, when we talk about back pain, people have different, timing for it, and we can use this to actually classify what kind of pain we've got. If we've got a back pain which lasts for less than 6 weeks, we say it's an acute pain. So we expect this pain to actually resolve within this period of time. So if you have pain now and the next 1 to 2 weeks, it's still there, yes, it may not be anything untoward, but within 6 weeks, we expect that to go with supports and management and other bits and pieces. And then there's one we call subacute. So anything, ranging between 6 to 12 weeks, and it's still ongoing, lasting for that period, we say it's a subacute back pain. But then we have a chronic back pain, which is ongoing. So any back pain that lasts more than 12 weeks, which about 3 months, then we say this becomes a chronic back pain. And as you know, in the back, you got your muscles in there, you got your nerves, you got your bones, and then within these bones, you've got some cushion materials in there, which all can be a little bit dysfunctional and cause back pain. Next slide, please. Right. When we look at how do we come about with back pain, we've talked about the thing that we've got in the back. You got your muscles, you got your nerves, you got your bones, and you got within your spinal column in there, you got nerves as well as this rib ring cartilage that we got in there, like a cushion there, which actually, supports your bones and prevent the bones from rubbing on each other. Now, as we grow older, this, ring-like structure can start wearing out, and the bones start pressing on them. When the bones start pressing on them, then there could be what we call a bulging of the disc. which normally can start pressing on those nerves and irritating those nerves. As you can see in here, that's the nerve running behind in there. And you can see some, cushion-like stuff in between your spinal bone. This is the backbone that we're looking at there. So those backbones, they are, arranged on top of each other like that. And within them, we've got what we call a disc. And so when this disc begins to wear out, you may have them bulging and pushing against the nerves. So when they put against the nerves, then they could irritate that nerve. And that's what we call sciatica. When it starts radiating to your thigh muscles and going to the back of the leg and then to your foot in itself. And you can see that this man bending down in here, you can see all those markings, which actually shows the distributions of the sciatica nerve. The sciatic nerve is actually why we talk about sciatica. That's the compressions and rotations of the sciatic nerve is what we call sciatica in layman term. And so that is pain from the back radiating towards the distributions of that nerve called the sciatic nerve. So any nerve from the lower back going towards your thigh, your leg, behind your calf, and then towards your foot. We call this sciatica. Next slide, please. Now, what are the things that could cause, back pain? A lot of things could actually be responsible for back pain. Number one, we look at malformations from what we call congenital problems. Is it because of the arcing of your spine, which could be scoliosis, kyphosis, or lordosis? These are all, back curvature that are not within the normal range. Those ones can cause pain. Sometimes we talk about sprain, when you lift something too heavy for your back, or you lift things in a very awkward manner, or you have an accident, maybe you fell down, or you trip on nerve, or you miss a step. All these things can cause back pain. Again, there's what we call wear and tear along your backbones as well as the disc. We popularly talk about prolapse disc, which we have, explained with the degenerations of the cushion being between the bones in there. That's when it starts pressing on the nerves, we call it problem. Then you got what we call muscle spasm. When your muscle becomes very tight because of your postures, then that could cause a problem. Now you have the nerve passes through a hole within your backbone. Sometimes there could be narrowing of this canal because of injuries or because of previous surgeries. This can cause back pain. Then scarring of tissue. When there's a healing going on, you form scarring because of previous surgery and things like that. That could cause a back pain. Now, there are other things that we need to look at, which can also cause back pain. Pregnancy, diabetes, tumors. When I talk about tumors here, we've got to be very careful, particularly in men, as we are. CA prostate can move to your back and cause significant back pain. And so when you have pain lasting more than 12 weeks and it's ongoing consistently and persistently, then you got to be worried. Now, fibromyalgia is just like a chronic pain problems. Endometriosis is more common with women, and that's when there is has to do with their womb. So we won't go into that much. Then you have kidney stones. Men who also form kidney stones. Usually that pain is in the back and then goes into your groin in front. So if you have a pain from the back, moving down towards your testicular area or towards your ball area, then you'll be worried about kidney stones. Now, the next slide, please. Right. Now, what are these factors that could, affect back pain? Age. How? The older we get, the more likely we get back pain. We are still very young at 50 and above. However, we're not getting younger. And so that can be an issue when your muscles start complaining, your bones start complaining, And then, so you've got to look after your back as much as you like as you grow older. Then your fitness level. If you are not into the active world, I know we are very, into that here. We're talking about being very active, moving and, sort activities, exercise and things like that. It is very important for our back. We need to keep our activities level very, very, within the acceptable level to prevent undue back pain. Weight. Again, overweight, obesity will be a problem for all your joints as well as the back. So extreme weight is not good for back pain. And then we have people that something is completely beyond their own reason, genetics. Ankylosing spondylosis is just like degeneration within the back, particularly with wear and tear. They're going on significantly. And then so some group of people have specialized kind of gene in them, which make them prone to this back pain, which we call ankylosing spondylosis. And it's very common among young, able people. So if somebody age of 20, 25 keeps saying my back hurts all the time, and then we can't find anything, we normally screen them for HLA-B27, which normally picks this up for people that have it. But again, it is there. Now, job-related factors. People who are in manual, jobs, laborers, people in building industry, even drivers, and even some of us in the office, we all have different positions, the way we sit, the way we comport our postures, all these contribute significantly to the back pain. Mental health, how does this relate? If you are, mentally uncomfortable, you might become more susceptible to pain. Your pain threshold may become quite heightened, and eventually pain might be more pronounced, at the back for various reasons, which might be due to what we have alluded to before. They've got smoking, osteoporosis, which is brittle bones, and when your bone is thinned out easily, that could cause a lot of discomfort. Then we have infections in the lower back too, which can be a problem. Then in children, when they are going to school and you load them up with different kind of things, with a backpack, that could cause a lot of discomfort for them. And so when a child is complaining of back pain, that might be because of overload backpacking for various reasons. And then we talk about psychological factors. Again, that stress, money worry, job, anxiety. A lot of factors in that category can also increase our pain, sensitivity, and could worsen back pain. Next slide, please. I've talked about back pain and its economic impact, as well as social, the social impact is a very significant problem worldwide. One, a lot of people do get time out because of back pain. So one of the main problems is absence from work, which can impact productivity. Also, we talk about chronicity. A lot of people with back pain normally have a recurring problem, and it could become a chronic problem. And like we said before, any back pain that is above 12 weeks can be tagged a chronic back pain. Now, when we talk about loss of productivity, when somebody tells you, I can't work because my back is spasming up, I can't walk, I can't do this, I can't do that. So once they don't turn up at work, eventually will affect their productivity. Even when they're working from home, if they can't do the job they're paid to do, definitely that will affect productivity, in all. Like I said, people who works in manual, work jobs, do stacking in the shops, in building industries, lifting, drivers and stuff like that. That normally affects their productivity a lot. Disability. Back pain is one of the leading causes of disability worldwide. and that has been evidentially documented, and it's also impacting on world economy in, in a large share. And then almost 62% has a recurring back pain in the populations at every point in time. So you can imagine that staggering statistics. And then lastly, economic loss. It is estimated that in year 2009, about 2.8 billion pounds was lost by NHS to back pain during that period. And I'm sure for the year that went out, it will be almost similar, if not more. And so it's something that we need to look at and take active, steps to prevent. Next slide, please. Right. What are the signs and symptoms of back pain? Pain is very, very common. So the pain, like we said, will be in the lower back, and normally any pain around that area, which is ongoing, may be associated with stiffness of the back when your muscle goes into spasm, and loss of flexibility, which was at night, particularly if you have been lying down for a while and suddenly you stand up, oh, my back hurts. Such things are, you need to be wary. And then usually they are one-sided. It could affect, the right side, and it could affect the left side. And that doesn't mean it could not affect the both sides at the same time, but usually it's one side. And it could be associated with numbness and tingling. Like we talked about the word sciatica. When the nerves are being irritated, then you will get that numbness and tingling. Now, I put the word red flags there. If the pain becomes any of these, then you need to get yourself into your nearest hospital. Not for your GP, your nearest hospital as quickly as possible. A constant, unrelenting pain, which is always at night. Remember, we did mention the fact that people can develop prostate cancer and have bones metastases, and they have persistent pain. Now, when the numbness is in the buttocks and in between your legs, that's like when you're sitting on a horse, the saddle there, if there's numbness around that area, it shows that the nerves in the back is being compromised significantly. That needs urgent attention. And so please don't sit at home, don't sit to wait for the GP if you have any of these symptoms. Muscle weakness, loss of bladder and bowel control. When you find out that you can't go to the toilet, both for wee or for the number 2, then you need to be concerned. If you've got a back pain and you are feeling very unwell with it, normally after the pain, then you become quite lethargic, become very tired easily. You can't, really get yourself together. Those signs are red flags. That means you need to be attended to ASAP. Next slide, please. Right, back pain. We've talked about things in there. Your muscle could ache, your nerves could cause aches, your bones could cause ache in there. And how do we diagnose back pain? Usually, your doctor will talk to you and your history will determine what kind of back pain you've got. So taking a very good history and physical examinations is very key to making a diagnosis. It could just be ordinary muscular pain, maybe because you strain yourself, or you sprain yourself, or you sit awkwardly, or you've been sitting for a very long time, or you did a bit of too much of gardening or lifting. Then we will pick that up in the course of talking to you and examining you. The number 2, X-ray. And some people feel, oh, well, I must have X-ray for my back. It is no longer appropriate if you haven't fallen down or you haven't been involved in any injury. X-ray is not going to show anything very significant. Sometimes, depending on what the back pain is, we may need blood tests. We've talked about screening for ankylosing spondylitis. That could be an infection. You want to screen for PSA of the prostate too, All those ones may require blood tests. You want to check for inflammations, ESR, CRP, that may be appropriate, but not in all back pain. Now I've got MRI, which is most of the things that we do now. Rather than doing an X-ray, the MRI is much more informative, and that will show your muscles, will show your nerves, and will show the bones in there too, which can actually give us better information and inform the decision in terms of management. The other investigations may be required as dictated by the history and examination from the doctor. So beyond MRI, you may have to do some other things. You may require ultrasound. You may require some other more invasive procedure, but that will be a function of the investigation, the examination and the history taken by your doctor. But generally, a good history from yourself to your doctor will give away what might be responsible for the back pain. Next slide, please. Right, treatment and prevention. I think this is very key. Usually when we have back pain and we have determined exactly what the problem is, for most back pain, most of them are musculoskeletal back pain. Usually painkillers, anti-inflammatory like ibuprofen or paracetamol will be okay, so long as you are not allergic to any of them. However, with ibuprofen, we've got to be very careful not to take too many because of the kidneys, and not too many because of irritation of the tummy lining, because it could cause bleeding if you take too much. Now, exercises, back stretch exercise, we've got loads of them on the web. So if you've got back pain, rather than just sitting still, oh, because it hurts, I don't want to move. You need to keep moving, and stretch exercise. That is the way to manage back pain rather than just sitting still. If issue with weight is a problem, then we will have to look at weight management as a pathway. Then we have the physiotherapy coming in there again, talking about exercises, and different exercises are available for the back pain, both to strengthen the muscles as well as to relax the muscles. And number 3, modifying ergonomics. Here, this is something that you do yourself as well as in conjunction with occupational therapists at work. If they look at what your seats look like at your height, they can work out the best way to sit in terms of making life more, comfortable for yourself. Again, changing our backrest angle, adjusting seat at work and positions, all of these are very important and key in back pain. Now, putting in there cognitive behavioral therapy. This kind of therapy, we use it in pain management, and it's also been used in back pain. However, this will go with chronic pain more, and it's not something that is routinely available under the NHS for now, except in certain cases. So we may not be able to assess that routinely for back pain, but it's a form of treatment that is available for a level of back pain under the NHS. Then we have the surgical management. If somebody develops problems of caudal equina, like we said before, if you start noticing that, you can't have problem with bladder bowels, or there is what we call cerebral anesthesia, like we described before, numbness around your groin area and in between your legs, then it may warrant an operations back pain surgery. But like I said, that will be determined mainly by the spinal surgeon. Then we've got about steroid injections. Again, that will be done by the bone doctors, and that's also available, but it is not the initial pathway. That will be after the analgesia has been done, the exercise has been done, physiotherapy has operated, ergonomics has been tried, weight management, then that will also come in. Then you have, manual manipulations, back braces. All these could be from the chiropractor and things like that. Acupuncture, also very helpful. Then there's what we call mindful meditations. I'm sure one of us here is quite mindful. I mean, it's very good with mindful meditation. So it's also a way of managing pain, not just back pain, but general pain can be managed with mindful meditation. So in all, basically, we can see in here that exercise is very key, managing weight is very key, painkillers is also a key, and then psychological management is also coming in very significantly. Surgical management, steroid, that might be something that is more amenable if there are other significant problems ongoing. Next slide, please. Right, and that is just reference for this topic. So in rounding up, back pain is very, very important. We as men in our age group could suffer from it. And when we suffer from it, it's something that could be managed and prevented. However, we need to be mindful of those key factors, the red flags, which are constant unremitting pain, which is worse at night. 2, if you've got tingling and numbness and affecting your inner thigh as well as your groin, or you got weakness in your legs, or you got problems with bladder and with the bowels, with your back pain, then you need to get checked very, very quickly. And finally, exercise, weight management, postures, very key. Thank you. Right. Okay. We've talked about this.
So thank you, Doctor.
You're welcome.
Before we start the questions, let me just